Good evening, welcome to IIT for you. Okay, so we already discussed this letter, how the case note looks like. Okay, so what is the writing task in this letter? Name of the patient is John Adams, and what is the purpose of the letter? Okay, so now we are going to discuss about how to create a good letter from this case note. Okay, so first thing, you need an introduction, right? To need an introduction. For introductions, we need what is the actual purpose of the letter, that is given that requesting follow-up care for Mr. John Adams. Okay, and the next thing is what is the presenting diagnosis of the patient and what procedure underwent um, to John Adams. Okay, so here it is clearly given the admission details, like, okay, so date of admission is 12th January 2025 and presenting complaint is sudden onset of severe abdominal pain radiating to the back, but the diagnosis is ruptured abdominal aortic aneurysm. So the management is in the later paragraph, but in introductions you can include the diagnosis, the presenting complaint of the patient, and importantly the presenting diagnosis of the patient and the purpose of the letter. The purpose of the letter is to give follow-up care to John Adams. So we just see how a letter looks like, and we'll come back to each sentence one by one. Okay, so let's see what's in this letter. So I'm writing to provide details regarding Mr. John Adams. So that's a simple sentence. I'm just providing the details regarding Mr. John Adams, who was admitted on 12th January 2025 for emergency surgery. So we know that is an emergency surgery from the case note. So you can see that on admission details, 12th January 2025 during an emergency. So that is we included in our sentence in the introduction itself. Okay, so who was admitted on 12th January 2025 for emergency surgery following a ruptured abdominal aortic aneurysm. Okay, he is recovering well and requires follow-up care. So that is the purpose of the letter. So we included that two important information, that is the patient present diagnosis and what is the purpose of this letter. So follow-up care upon discharge planned for 19th January 2025. So you can say either today. Okay, so like he is recovering well and requires follow-up care upon discharge today. So that would be better. So this is looks like a good introduction. Okay, so after the introduction we should continue the letter with the following informations. What happened to Mr. Adams? So that is including his medical history. You can see the medical history from the case note that diagnosed with an abdominal aortic aneurysm 3 months ago, and he's a smoker, hypertensive and type 2 diabetes. So we have to include that information in the first paragraph. So Mr. Adams was diagnosed with an AAA, or you can say abdominal aortic aneurysm 3 months ago. His medical history includes hypertension managed with Ramipral and diet controlled type 2 diabetes. Notably, he is a former smoker, having quit recently. He lives alone with limited mobility, though his daughter provides support twice weekly. So we included his social history as well, because that is also important after the surgery, because of his how we can provide him a follow-up care for Mr. John Adams. Okay, so Mr. Adams was diagnosed with an AAA 3 months ago. His medical history includes hypertension managed with Ramipral and diet controlled type 2 diabetes. Notably, he is a former smoker, having quit recently. He lives alone with limited mobility, though his daughter provides support twice weekly. So next thing, we are going to say what happened to Mr. Adams after or after he was admitted to the hospital. So during admission, so he underwent emergency open surgical repair and recovered without complications. This information is from the case note itself. We can see the after the admission details, what things we have provided to Mr. Adams, because you can see, but for that you have to say again, repeat in a different way what happened to Mr. John Adams. So there was a surgery performed, then emergency open surgical repair was performed, and we are not saying the 3 days, but instead of that we are saying, so recovery was uneventful. That means there is no complications after the surgery. So then we are saying his wound is healing well with no signs of infection, and his blood pressure and glucose levels remain stable. Why we are talking about this blood pressure and glucose level? Because the patient is hypertensive and he has been diagnosed with diabetes as well. Okay, type 2 diabetes as well. These are the important things you should always carefully observe while you are reading the case note. Okay, so then we are slowly transmitting or slowly writing from one point to another in a way that, see, you can see that transmission here. Then we are going to pain management. So then we said the important parameters: the wound healing, blood pressure, infection, and glucose level. Then we are going to the pain management. Pain management is also mentioned in the case note, that a discharge plan. So pain management with paracetamol. So you can write it in a different rephrase manner, that pain management includes paracetamol. And again, next we are moving to physiotherapy. This is all discharge plan we are discussing in the second body paragraph. Physiotherapy has been arranged to improve mobility. Okay, so then we are going to moving to the third body paragraph. So that is the recommendations for doctor. Okay, so the receiver. So I recommend regular dressing changes every 3 days and monitoring for signs of infection or other complications. There is no harm using I recommend, because it's an active sentence, or either you can write Mr. John Adams requires dressing changes every 3 days and monitor for signs of infection or other complications. Additionally, please reinforce diabetes management strategies and encourage smoking cessation counseling to prevent further vascular issues. He will need a follow-up appointment with a vascular surgeon in 6 weeks. So then you can conclude the letter, because you included all the relevant information regarding the case notes. So that means there is no information is missed. All the relevant information is included in the letter, and letter is in within 180 to 200 words, and the address is to Dr. Laura Perkins. Okay, so then you can conclude that. Please feel free to contact me if further clarifications required. Then yours sincerely. So that means your letter is complete. So this way you can write a good letter. You can take it as a sample letter, and it's also provided in a separate posting in our website, okay, or 84u.blogspot.com. You can search and write your letter and post in our web, WhatsApp, and Telegram channel as well. Okay, thank you for watching the video, and every day we are providing one new case note to improve your writings, and you can feel free to write your letter and post it in our group, and we will discuss that letter through the medium, and will get back to you. Okay, so thank you for watching the video.